Happy Epilepsy Awareness Day. Welcome to Rock the World with Kay and Michelle. We explore stories of courage, resilience, and innovation, highlighting both the similarities and diverse experiences that unite us all. The experiences we discuss on this show are for educational purposes only. Please do not substitute them for professional medical advice, diagnosis, or treatment. And if you notice any pauses during this episode, we ask you to keep listening. Sometimes, someone's processing their thoughts or it's part of the natural flow of conversation.
Hi, I'm Michelle, creator of Movement Lesson. We are doing the podcast today of special needs, medical and genetics, or versus genetics, which sometimes are together, sometimes are not, understanding the differences, but also the similarities. I am known for my modality. Movement Lesson is a modality. I'm known for that, working mainly with special needs, but I work on anybody from high performance athletes to munchkins. And Kay and I have teamed up to do this great podcast showing you how to rock the world. Yep.
I'm Kayla Ireland, founder of Kindly Neurodivergent with Kay. I'm here to rock the world. How was your time in New York?
It was good. A lot of people don't know this. I'm actually born in New York in Manhattan, so it was nice to get back home. I didn't see anybody per se. I was actually in Brooklyn. I have a big following or community with the Jewish the Hasidims. And so I was right in the community for 2 weeks helping them. And it's really interesting. I love being back and all of that, but I'm happy to be back in Phoenix. And also for those of you that are trying to reach out, please understand when I am working, that I'm working on top of working. So Movement Lesson doesn't shut down. It's an international business. So on that aspect, I'm a little tired, but catching up. How are you doing?
Distinguishing between medical and genetic-based special needs is key because it impacts the approach to caregiving, support, and advocacy. Understanding these differences equips families to manage care and plan for the future.
Right, exactly. And genetics testing, for instance, can give us insights to the risk of any genetic disorders because genetic disorders can have medical complications, but also non-progressive or regressive complications. So it's necessary step to rule out the following. First, let's say your child had birth trauma, right? But is it due to an underlying genetic condition, right? So a lot of people think that since there was trauma, they're not looking for genetics, and the two are can mask each other, but they're similar but different. Two, are there any immediate short-term, long-term issues with genetics due to birth complications? Due to birth complications, to stress and exhaustion to the child versus a lot of genetics are regressive. So it's like, especially muscular dystrophies, a baby can start losing abilities quite quickly. Respiratory usually being number one. But it could be kidney functions, it could be all of that. So that has to be looked at. And three, there could be again well, I said immediate regression, but again, it's understanding, is it genetic or is it due to birth complications, right? And the team should know about what's going on. The needs need to be clear to help empower families to make informed decisions about the health and family planning. We've said this before on our podcast, right, Kay? We don't plan for special needs. It just sort of happens. And here we are. And so that's why we were here to distinguish, because a lot of people see medical and they're not looking for genetics.
Absolutely. And before we dive deeper into the topic, let's share a quick personal experience. Have you had any experiences, Michelle, where understanding the distinction made a big difference?
Absolutely. gonna ad lib a little bit here. My son got very sick or regressed severely at 13 months. They didn't think he was very sick because there was no fever. But my son was walking, talking, and he couldn't even roll over. So we lost over a year of milestones. And so they started doing what I was calling the disease of the month club. And they actually took me aside and said, "Why aren't you? We're worried that you're not worried." And I said, "Listen, you're telling me my son's going to die in 6 months, 2 years. He definitely wasn't going to make it to five. And they were trying to figure out why." And I said, "This disease of the month club is necessary. You tell me what my son has, I'll deal with it. But until then, I'm not participating. I'm keeping my son stable. But, here I'm worried about muscular dystrophy when it wasn't. So what my son had was he had medical regression due to Haemophilus influenza. It's a vaccine that you get, Hib or HIB. It's Haemophilus influenza bacterial. And instead of getting the antibodies, he got the infection behind the eyes, base of the brain, and staph also went on it. It was a life-threatening sinus cranial infection. And even today, my son could die without his medication. Going from helping my children to helping everyone's children, when I first started working with families, um, many were confused that their child's challenges were medical or genetics. And you have to understand, yes, it could be genetics, but you've got a medical situation. Or yes, you have a medical situation which is stressing out. I wouldn't say the genetics, but again, yes, the organs or whatever. But like my son, he had sepsis, preseptal cellulitis. I mean, he was dying all the time for about 5 years, and he's had 30 surgeries in relationship, 18 alone to the head. So I personally know the need to understand medical and genetics and the confusions and the impact that it has, and just also the emotional coping. And that's what I'm just passionate about. Nobody should have to go through what my child went through or my family.
I exited the womb and into the world with the assistance of a vacuum as an unconscious, full-term baby. My pediatrician performed CPR to give me my first breath of air. An emergency transfer was initiated to another hospital better suited for my needs. I also have a history of seizures. With that said, my primary diagnoses are cerebral palsy and epilepsy. This distinction is of significant importance to me because some individuals may misidentify themselves as having cerebral palsy when, in fact, they have a genetic condition that closely resembles cerebral palsy. Such misidentification is deeply hurtful to me, as cerebral palsy is a condition that is caused by brain damage occurring before, during, or after birth. The room in which I was born was filled with medical professionals.
Absolutely. And you have a right to have your and to stand up and to because you've been through it. You've been through it. Um and when people identify in any condition to say you're just like me. Matter of fact, I just did a Facebook Live on that when someone was saying, I want to know who else has brain atrophy. What happened to your kid? And I'm like, we're dealing with your child. We're not dealing with you comparing yourself to somebody else's child first of all. But yes, after what we've been through, like to say my son didn't have that happen to him. When I say, oh, my son's had 30 surgeries, and people say that's not possible, well, I'm making it up, you know. And so like the same thing with your struggles of just a life of cerebral palsy, and your responses to movement are based off of brain damage, versus a genetics. So, and today is Happy Cerebral Palsy Day or Cerebral Palsy Awareness Day. So, and again, it's about making people aware. So let's define the categories.
Yesterday, let's break it down. When we talk about medical-based special needs, We're referring to conditions that arise due to procedures, complications, or trauma. For example, birth-related complications, brain injuries, or infections can cause medical conditions that impact development.
Exactly. That's what happened to my son, and that's what happened to you. Births should be an amazing experience, but complications can sometimes lead to challenges that affect a baby's ability to thrive. Your baby can also become medically delayed. That's one thing they wanted to say, at one point wanted to say Graham was he was medically delayed, but due to getting services and due to getting and needing a diagnosis, I'm like, you touch that piece of paper. I told him I'll kill you. And I said that lovingly. I wasn't being, but again, but still, yes, my son was medically delayed, but my son also has a range of diagnoses. But listen and learn in our last episode where we really discussed medical conditions in greater details. Our podcast has been going on now for a little bit, and we're already covering lots of vast subjects here to help you as parents and caregivers.
What is the difference between medical and development delayed?
So, well, your number one objective is to medically stabilize your child. That's number one. Now, just that being said, parents aren't necessarily born doctors. But they joke around with me sometimes. They're like, "Are you a nurse? Are you And I'm like, "Nah, just been through it. Our school of hard knocks." But I had to learn about infectious disease. I had to learn about immune failure. I had to learn about cortical visual impairment. My son started off school at Foundation for the Blind. I had to learn about autism. I had to learn about being progression based versus regressive. So there's lots of coming in. So can have a medical condition. Like I work with a lot of kiddos that are missing part of their heart, right? Tricuspid atresia that has nothing to do with their brain or so forth, but because of the open heart surgeries, their sternums being cracked open, complications of the medical base, but not necessarily trauma, but it is trauma if you're cracking someone's chest open, especially when they're 6 months old. So again, you're going to have a medical delay because a child's going through prime periods that they should be sitting up and crawling, and they've got shunts and tubes coming out of their chest, right? It didn't affect their brain per se, but their brain was not able to do what it needed to do to match up the movements. So there's complications of medical delays, or when child's just literally like, you know, in the hospital for 3 months with the flu and they can't kill it, or kick it into a respiratory distress. That still wasn't trauma to the brain, but the child might be very weak or have muscle atrophy for being in the bed too much. There's lots of ways there that can be pretty severe that cause medically delays versus again medical trauma like something like you being having the brain bleed and the seizures also. You could have fine, but the seizures just becoming neurologically damaging to the brain. You can die from seizures. It's no joke. It's um so there's quite a things that need to be looked at specifically um, that cause these things. Whereas genetic special needs or conditions arise due to changes in the genes, the chromosomes, and this happens in utero, even though it might not show up to adult onset. Like my dad has adult onset muscular dystrophy, and his brothers did too. It seems to be an X factor. This is something again I have to look at for my children. They will not test my children for Charcot-Marie-Tooth, and I'm just like, Dad's still alive. He's got DNA. Why aren't we doing his blood test, my kid's blood test, just to rule out? But my children, my boys, my cousins risk Charcot-Marie tooth being again, we haven't seen it in the females of the family, but they're in the males. But when I had my children, I didn't know my dad had it. He got it when he was like 55. So these conditions again can be inherited or passed down from parents. I could be a carrier. I don't know. I haven't been tested. Doctors don't spend that kind of money. This is where the weight comes in. Or it's called de novo, where it's just a spontaneous mutation that happens during conception. And surprise, nobody else in the family has it.
These are caused by genetic mutations that either arise spontaneously or are inherited from one or both parents. These conditions are usually present from birth, though some symptoms might not develop until later on.
Right. And there are very common ones, like some common genetics diagnosis include, again, so we're looking at a genetic mutation. Genes mutations are changes in the DNA, which is a sequence that can be inherited or arise again spontaneously, de novo. These mutations can disrupt the normal body's function. It could go right after, let's say, the kidneys. It all depends, or they're leading to development, intellectual, and physical issues. So one big known one is sickle cell anemia. Now they just had a big breakthrough with that, but it's a mutation of the HBB gene that causes red blood cells to become sickle shaped, and leading to anemia, pain, and organ damage because the right nutrients, including oxygen, are not getting to the areas of the brain. This is a good example of becoming medical delayed. A child can get very sick from sickle cell, and not be able to run around and do things just due to the blood, factors. Whereas another one is like muscular dystrophy. And now muscular dystrophy, there's about 60 of them. So we're going to just cover it too. By the way, if we do not cover your diagnosis, there's genetic conditions like we could be here for five years. Proper respect to the genetics. So please, guys, we're not leaving anybody else. We're just trying to describe the differences. Like here, there's a gene mutation, but muscular dystrophy is a group of genetic disorders characterized by progressive muscle weakness and loss. It's caused by mutations in genes that encode proteins essential for muscle function, right? But that there's spinal muscular atrophy. We can go on and on. Then there's chromosomal abnormalities, where the abnormalities occur when there's a change in a number and or the structure within the chromosomes. Individuals may have extra chromosomes, or they're missing ones that lead to variations of development and health challenges. You sometimes will see more intellectual conversations or that can happen here. Now, like Down syndrome, chromosome 21. Individuals with Down syndromes have an extra copy of 21, leading to intellectual disabilities, characteristics of facial features, health problems, and heart defects and gastroenterology issues. But like the heart issues, the lung issues is the T2, right? And but there's well-respected people that have gone on to become lawyers, uh, college graduates, and all of that. So to assume that your child has Down syndrome and the plight is going to be affected with issues again. But Down syndrome, if you're watching in my group, Erin Folks, her son, where you're seeing the medical delays, well, this is what happened. He ended up in the NICU for 6 weeks due to respiratory distress, and he wasn't maintaining blood. So he had a pseudo
Wow.
yeah, he had a pseudo leukemia. He had to have 4 blood transfusions before he started making blood. He kept, you're supposed to have 150,000 blood cells, and he was going down to 25,000. So he would have to get transfusions. And but she clocked in, she thinks 125 hours of movement lesson. He didn't qualify for physical therapy during this time. He didn't qualify for any services in this time. I know, 6 weeks in the hospital, just like UK. And so they're like, wow, he's actually leaving. He looks like a baby. And then and Karen's just like, I worked my, I worked on him all the time, but parents sat there.
Mm.
So this is also another example of medical delay. Um, Klinefelter syndrome, which is an XXY, males with an extra X chromosome.
Ridiculous.
It is ridiculous, but and not only that, but they were so shocked at how well he did. And she goes, "Do you not see what I'm doing here?" Like, he was presenting with head control and that kind of stuff where, outright, if she wasn't involved, she just let him lay there. The outcome immediately would have been extraordinary. He still has Down syndrome, but
Mm.
so but Klinefelter syndrome, also has developmental delays, learning disabilities, infertility, and other physical traits like a taller structure. Turner syndrome. I have a client with Turner syndrome. It's X female with only one X chromosome, leading to short stature, not necessarily infertility. That they are not born with the interior parts of a female. Potentially learning difficulties, not at all. She's a volleyball player, but again, she had me right at birth. And especially they say, especially math and spatial reasoning, she doesn't have any of those. You would not know that this child is delayed. The one thing I will say with Turner syndrome too, you have a bit of facial, her brow or hair goes, she's got the tallest forehead I know. And bilingual, bright girl. She's just turned 13, volleyball, like I said, school. And but yeah, she won't be able to have children, but that's really that the only aspect that I can see with her. I think that's a little bit taxing on the kidneys as well, but single gene disorders. These disorders are caused by mutations of single genes. They're typically inherited in clear patterns, can result in significant developmental and physical challenge. Cystic fibrosis. Mutation in the cystic fibrosis or CFTR gene affects the lungs and digestive system. This is one of the things Graham was tested for that they thought he had and cause thick mucus buildup and leads to respiratory and frequent infections, digestive issues, but also early demise. Cystic fibrosis, it's very difficult. It can be very difficult to make it to 20. There's cases that go beyond that, but there's famous cases of beautiful children, young adults, and they're just their lungs just fill up with mucus. Tay-Sachs disease, a mutation of the hexa gene, leads to the destruction of nerve cells in the brain and spinal cord, resulting in developmental regression and loss of motor skills, eventually death in early childhood. Um, Duchenne muscular dystrophy, again, another form of muscular dystrophy, DMD. This one's quite severe, mutation. This is what they thought Graham had, and mutation of the dystrophin gene caused by muscle weakness and loss of function, leading to progressive degeneration of muscle tissues, starting in early childhood. I think the risk of death could be anywhere from 2 to 10 years old in some cases, not all. Again, there's always exceptions, but there's a lot going on right now with genetics in that way. With spinal muscular atrophy is another form of muscular dystrophy. Again, there's about 60 disorders that are under MDA. By the way, if you have an MDA, anything that goes under the MDA Association in the United States is amazing. There's 215 hospitals around the US. So if your child gets sick anywhere around the country, you can go to an MDA hospital. They're networked. They do a lot of clinical trials. There's a lot of funding in MDA. Get involved. You could have a lactic acid disorder and it could be covered under there. So do your homework on that. And then more complex genetic disorders or conditions, they involve multiple genes and can be influenced by environmental factors. While genetics may play a significant role, these conditions are typically not caused by a single mutation or the interaction of many genes. We're looking at autism or autism spectrum disorder. Research indicates that autism components, but so this is my take with autism. Autism used to be Fragile X, Prader-Willi charge, specific genetic conditions that leads a child to the lack of those social skills and stimming, and that the autism, you're usually diagnosed for the most part with the autism. You're failing a 400 question test. The parents are really diagnosing their child with autism. They don't know it, but you're answering all these questions. But the genetics cause risk factors like Prader-Willi, growth hormone issues. They literally, some can eat themselves to death. They will break through sheetrock for a potato chip if they're not put on a very specific diet from day one. Absolutely no sugars, no, to keep them from craving those types of carbs. Very diligent with the parents, lower IQs typically. nonverbal, some, but not all. Again, that's why we have the spectrum: charge, heart disease, epilepsy. Um, and so those things that come into play. But I really believe autism is also a movement disorder. Excuse me, and that's why we're going from 1 in 20, from 1 in 3,000 to 1 in 20. It's not about better diagnosis. I'm 60 years old. Kids I went to school with, I wouldn't go back now and say they should have been diagnosed, although people are adults and becoming diagnosed with it. Schizophrenia is a mental disorder, complex genetics, environmental factors, including mutations of the brain. I think the MTFHR is affected with that chemistry structure, and it could be late adolescence or early adulthood. Bipolar, a mood disorder, genetics, just predisposition, but also can be due to medical trauma, like drugs during pregnancy and so forth. Um, Multiple genes contribute to the risk, but environmental triggers like stress and can activate the condition. Mitochondrial disorders. I know we're covering a lot here, folks. But mitochondrial disorders are caused by the mutations of the mitochondria or the DNA, which is inherited or exclusively from the mother. But again, not in everyone, but there's typically that's the case. And the mitochondria are the energy producers in cells. Mutations can affect the body's ability to generate energy, leading to the variety of conditions. And again, my son was tested for that, muscle and skin biopsies, but I didn't know that you can literally with mitos, you can DNA test right here, skin biopsy test, and it could be over here.
Mm.
Mitochondria can replicate up to 17 times faster of your typical DNA replication. So depending on what type of mito you have, it could be short-term to long-term concerns real fast, because the replication is 17 times faster than, like, say, typical DNA. So the child's progression of the mito is huge, and at the same time it could be lower than that. So Leber's hereditary optic nerve neuropathology, LHON, it's a mitochondrial disorder that causes vision loss during the degeneration of the optic nerve, often being in young adulthood, leading to permanent blindness. Mitochondrial myopathy, where conditions affect muscles causing weaknesses, fatigue, and other issues. Mitochondrial mutations impair muscle cells' ability to produce enough energy or receive it. So the muscle just goes into failure. So it all depends, but I believe in working on all of these. So let's look into the statistics of genetics, because 1 in 6 kids are special needs right now.
If you have any disorder and want to be on, let us know.
Absolutely.
1 in 200 to 400 live births is affected by a serious genetic disorder. Cystic fibrosis affects about 30,000 people in the U.S., with 1 in 3,500 live births diagnosed. Sickle cell disease affects 1 in 365 African American births in the U.S. Down syndrome occurs in 1 in every 700 births in the U.S. 1 in 36 U.S. children is diagnosed with autism, and there is a genetic component in many of these cases. 1 in 20 individuals carries a gene for a recessive inherited disorder.
Right. But we're not here to just discuss what these disorders are. We're here always for encouragement and actionable takeaways. So whether your child condition is medical first or genetic or both, there's always hope. Hope comes in knowing what your child is going through and understanding their needs. The real solution is for you to have a plan. That's what, if you don't have a plan, now you're consumed by worry. Take it by someone who knows. The greatest gift my son taught me was not to worry. I worry about what's real. but again, this disease of the month and all of this, what we went through, I couldn't participate. I couldn't be worrying about my son dying in 6 months. By the way, my son is now 22. So, again, all that worry for something that just never happened. But first, your plan is to get your child medically stable. That probably took me about 5 years to get him stable.
Oh.
That's just get them stable. And I didn't get them fixed. I got them stable. There's a difference.
Ugh.
It took me over 5 years, right? And then I had to deal with, again, so I was behind the eight world. But the second is to understand your short-term goals and your long-term genetic precautions. Because again, sometimes you can have genetics issues that show up in their 15, 20, like one of my good friend's daughter never, they thought she had autism. She just got diagnosed at 25 with Pitt syndrome. She had seizures starting at 17, so the scoliosis is hit. So these things do affect um as you go on, that you will see other complications.
Or your dad.
Yes, or my dad.
Absolutely. Progress is happening, and through medical care, research, and therapy, we are seeing positive change. It's crucial to understand the differences so we can support those affected in the best way possible.
Community support is vital. There are great tools, Facebook and YouTube, because I can't stress it enough. No one planned for any of this to happen. Families, caregivers, professionals all play an essential role for inclusive environments that foster growth, success for those with special needs. But have to say it again though, nobody planned for it. You will have some DNA testing, by the way. I will add this, like say for Down syndrome, you might know ahead of time due to a small microarray that's done prior to births or might show up on the ultrasound for warnings. So parents might have a heads up, but usually it's a surprise.
As we wrap up today's episode, remember that no matter whether the special need is medical or genetic, the ultimate goal remains the same: improving the quality of life and fostering independence for individuals.
Absolutely. And for babies, again, medical stabilizations is everyone's first priority. Please, guys, whenever we're talking about this podcast or anything that I say on Facebook, YouTube, don't go back and second guess yourself. At the moment you made a decision for your child or yourself, you made the best decision possible. Give yourself a pat in the back, a sigh, a cup of tea, whichever it takes. You made the best decision. We're all smarter 5 minutes after the fact. All of us are smarter 5 minutes after the fact. We shouldn't have did that. We could have done that. We don't know. We don't know. We did what we could. But but I'm working on, like, say, me personally, an infant sensor mat that checks all infants for movement conditions right at births. I'm in the prototype stage, but it's happening. And
Yeah.
it's not about what people think is early intervention. To me, early intervention is waiting to see, oh, I think I have a problem, I should do something. Early intervention means all parents and caregivers need to help their babies from the very first day. Because you might think, oh, I didn't have medical trauma, so there's nothing wrong with my baby. This is what we're trying to say. There's a lot of genetic components out there. And the quicker you get to know your baby, they'll show you the signs if they need to. And so you can experience, or your baby can experience all the movements they need from the get-go. So again, please, if there's any complications, the sooner we can address these conditions, the long-term outcomes will be better. That's the whole thing.
Building a strong support team, doctors, therapists, specialists, is crucial to provide the best possible care and create a roadmap for success.
Right. And Gay, like look at Kay's example. I'm sure the first days of life, her mom's not thinking, wow, I can't wait till we're done with all this and Kay has her podcasts up and running. You know what I mean? Like, And so, and so it happens. It can happen, but sometimes patience is there.
I had a big breakthrough grand mal seizure 2 years ago.
Yeah, I mean, there's still surprises. Mm.
For
But
genetic conditions, genetic.
Oh, sorry. I before you jump in, Kay, sorry to interrupt you there. Let's not forget about assistive technologies. They truly can make a significant difference, especially in areas like mobility, communication, and independence. We've said it on other podcasts but really the opportunities that we have today, we're looking at, maybe you're looking at short-term or long-term goals of having an assistive device. Look at how much technology has changed in even just 10 years. Even Kay could tell you she was probably just pushing these buttons, and now she's getting paragraphs out and she can do so much more with her systems that will continue to get better. Take advantage of it, learn into it. They really can make a difference in your life.
For genetic conditions, genetic counseling can be incredibly helpful. It allows families to understand their risks and better navigate treatment or care options.
And sometimes you just have to be financially informed if you're dealing with a long-term concern to get your ducks in a row that way. But stay informed with the latest breakthroughs. I can't stress enough, like places like the Muscular Dystrophy Association or Facebook groups and so forth, how it can help you for stay advanced into gene therapy, uh, and all of that, offering hope for better treatments, possibly lessening the severity to any child having this experience. I don't know if anything that has cured a condition yet, but certainly they have lessened the severity or halted the progression, and reins on a horse's, like SMA was life-threatening up until, like, they want to say 2015 or 16. And now the medication's expensive, so in some countries they still don't give it, in Egypt for one, but the treatment is out there to stop it. But one injection every 3 quarters is about $200,000, or a one-time injection's 2.5 million. Um, yeah, so some insurances aren't stopping it. So again, it's out there, but stay informed, because like technology, this will only get better.
Before we go, we'd love to hear from you. Please share your questions and experiences with us. Your stories and journeys matter to us, and we're here to guide and support you.
Get ready for our next episode. We'll be diving into exactly what a movement disorder is. But before that, do not forget to subscribe, share, keep the conversation going. But most of all, please, guys, for those of you that are in the support groups, share this. Let the parents know that there's other resources. Because let's say you don't need this amazing podcast, which I can't imagine that you wouldn't say that. That doesn't mean that your friend or someone that you just don't know that's around the world, that you might, if you post it, that they will get resources out of it that you maybe don't need at this moment. Sharing is great, whether it's our content or others.
We do not just talk about special needs.
No, not at all. And we talk about what it's like to exist in today's planet. And sometimes we all are considered special needs. If we can't do what we need to do and we need help, that's what it's about. And that's why neurodivergence is there, that all of that stuff. It's about diversity. It's about understanding neurology and emotions and finances and doctors and lawyers, and it's just and we'll cover it. We will cover it.
Find us wherever you listen to podcasts and watch videos. We're here to bring our passion, knowledge, and perspectives to help you rock your world.